term castration is removing the gonad, so any kind of reproductive portion. And then neutering is saying to desex an animal. So really the proper term for what we do to male dogs would be castration rather than neutering. Technically we neuter both. So just a little definition thing there. So just some facts mostly because everyone's always, are they going to get fat once I spay them, things like that. So technically estrogen as it flows through the body does suppress the appetite. But even though it does that, there are certain things we can do by decreasing the amount of food we give them and things like that that prevent them from getting too fat and everything. And as we have the don't let her spay into your critters over there, the number one cause of pet death is euthanasia due to overpopulation. So, I mean, you guys have all been in shelters, you know how many animals are in there. A lot of times it's just due because somebody had puppies that they didn't want puppies, and down the line they ended up in the shelter. So, okay, so consequences of not spaying. These are kind of the topics I'm going to talk about, just a couple that I thought off the top of my head. Pyometras, mammary tumors, pregnancy, which you don't always think of pregnancy as a consequence, but I can explain to you kind of why it is, and then false pregnancies, which is probably the least worrisome on the list there. So, okay. So pyometra, by definition, is when the uterus fills with pus. It happens very shortly after a female goes into heat. The more times they go into heat, the more likely they are to have this happen. And that picture is actually me taking one of those out. So it's hard to see, but this whole thing here is actually that dog's uterus. Yeah. So that was a emergency surgery at about 10 o'clock at night. So I put it in there for you guys. It typically happens in middle to older age animals. So like I said, the more times they go through heat, the more likely they are. Typically what you see is they'll call and say they're laying around, they don't want to eat, they're drinking more, things like that. Or there's this, thank you, there's this discharge coming out of their vulva, it smells like pus, those kind of things. When you see the discharge, it's actually a better sign because we do have two types, an open and a closed. It's based off of the cervix. So if the cervix is closed and none of the pus is coming out, you have a chance of not knowing that the dog has a pyometra, which can lead to a rupture of the uterus into the abdomen, and that causes a whole gamut of more problems. So what we do, we spay them. So spaying them when they're younger, less heat cycles, helps to prevent this from happening. And unfortunately, there are ways to technically treat it in a breeding animal if we need to, but once it happens once, it's more likely to happen again. Okay, mammary tumors. Alright, so nice little facts over there on the side. So if your dog goes through its first heat cycle, the percent likelihood of it getting a mammary tumor jumps from 0.5% to 8%. That's a pretty drastic jump. And then anytime after the second heat cycle, it goes up to 26%. And from there, even if you spay them, they're still at that 26%. So it's a pretty high percent there. Cats is a little different, 0.6% likelihood if you spay them before they're a year old. And it is the most common tumor of female dogs. So middle-aged, older dogs, the breeds that are most likely are poodles and dachshunds, but we do see them in other animals as well. It can be one gland like we see here, or we can have multiples, maybe one really big one and a couple smaller ones throughout. The treatment for that is always surgery. We either take off the entire chain, which is what it means by a mammectomy, or just the lump itself as the one mammary gland, which is the lumpectomy. And this is not one of my patients, but it was a pretty good representation for you. Okay, so pregnancy, just like in humans, there can be complications. Some of the ones we typically see are what we call dystocia, which basically means they didn't have them the way they were supposed to. They're backwards, too big for the canal, they get stuck, things like this. So, by definition, inability to get the fetus out. What we usually see during the brown discharge, they're straining to have the baby, but nothing's coming out, things like that. A lot of times in situations like this, we either lose the puppies, before we can get them out or trying to get them out, or we also have the risk of losing the mother as well, depending on how things go. So a lot of times, if you catch it early enough, you can sometimes get the puppy out with a little assistance from us. A lot of times, though, we have the C-section. So you have to go in, kind of like doing a spay, open it up, pull the puppies out that way. So pseudo-pregnancy or false pregnancy is kind of the lowest worry that we have. What usually happens is the body goes through a heat cycle, and then once the heat cycle ends, the body thinks that it's pregnant. So it goes through all the same things that it would being pregnant without the actual growth of a fetus in there. So we get mammary development. Sometimes we'll see milk, things like that. Most often we see them, they'll find a toy or something and they'll treat it like it's their puppy. So they growl at you when you go near it, they won't let you take it from them, they guard it, things like that. And unfortunately with this, once it happens once, it has a likelihood to happen again. Okay, so consequences of not neutering. So a lot of things that come with not castrating or neutering a male dog are related to the prostate, just like human men. And then we also have testicular problems, neoplasias, and torsions as well. So, benign prostatic hyperplasia is a fancy term for meaning that your prostate's bigger than it's supposed to be. So, older, intact male dogs, a lot of times we see blood in the urine. They're urinating and there's blood in there. It's usually because of this. Because the prostate gets so big, they get smaller amounts of urine out, so they go to the bathroom more often. They strain because the prostate's pushing down on that urethra, and depending on the size, it can be pushing up on the colon as well, so they're straining to poop just as like straining to defecate there. Typically, doing castration fixes the problem, everything goes back to normal. So this is an x-ray. This kind of white blob is the prostate. On a normal x-ray of a dog, you won't be able to see that. So it's pretty big in that picture right there. So, along with that, we have prostatitis and a prostatic abscess. So prostatitis, infection or inflammation of the prostate, prostatic abscess, you guys know what abscesses are. So same kind of similar signs, difficulty pooping, difficulty urinating, blood in the urine, their abdomen will be painful. Sometimes they don't want to eat, sometimes we have a fever. And then so this is the whole prostate on an ultrasound, so different kind of image. All of these darker circles are areas of where there's pus and infection in that prostate. Yeah, I saw that. Yep. So we treat it with antibiotics if we catch it in time. Just like with the pyometra, if it happens to rupture, then you get all that infection in the abdomen, and then you have a bigger problem on your hands as well. Okay, so neoplasia of the testicles. So crypt orchid males means that one testicle stays in the abdomen or in the inguinal area, doesn't advance into the scrotum. In these dogs, they have a 13.6 times greater likelihood of getting a cancer of the testicles. Cryptorchidism in general is heritable, so that leads us kind of into the breeding aspect where they can still have puppies, they can still breed, but if they're a cryptorchid, they're more likely to have puppies that are cryptorchids as well. So the main one we see is what we call a Sertoli cell tumor. It's related to cells inside the testicles. It's a worm type. What we see, because they produce more estrogen than they should, we see mammary development in a male dog, so you don't typically see big mammaries in a male dog, the hair loss, and suppression of the bone marrow due to the levels of estrogen. And that is a picture of a dog that actually has this syndrome. So you can see kind of not a lot of hair, kind of funny looking, for lack of better terms there. And then we have testicular torsions. So they're just kind of hanging out in the scrotum. At any point, they can spin around and cut off the blood supply. They can do a whole twist or just a half a twist and cut off just the amount of blood supply, and anything without blood supply is not usually good news. So. Alright, so that's the end of the spay and neuter portion. You guys have any questions about anything? Okay. Alright, so responsible breeding. Kind of summarize kind of what's mostly on here. If you're thinking about breeding, it's best to do your research on the breed that you have and the parents, their bloodlines, and everything like that. So this is kind of preparing you here. There's an art and a science to it. It's not as easy as just kind of going out, putting two dogs together, seeing what happens. There's, especially for purebreds and things like that, there's a lot of bloodline requirements, a lot of things related to genetics, heritable consequences like the cryptorchism like we talked about. So doing your research, it's actually pretty expensive because you have to take care of the mother, you have to take care of the puppies once they're born for a certain period of time. It requires vaccines, deworming, everything like that. Hi. Sorry. No, you're okay. Come on, have a seat.
Come on in.
We'll get you one of these real quick. Thank you very much. Yep. Okay. Alright. So, a lot of times the reason people were breeding is because they had a trait that they really liked that they wanted to continue on. So, as you're breeding, knowing the good parts and the bad parts about your breeding animal, so that if there is a particular flaw, you can look for a mate that doesn't have that flaw, so that you kind of tone it down a little bit, boost up the good traits, and kind of push down the ones that we don't really like there. The commitment. So, like I said, raising the puppies, taking care of the puppies, taking care of the mom after they have the puppies, everything like that. It's a big responsibility. Puppies, yeah, they can feed themselves on the mom and everything, but once they're weaned, you still have to feed them, vaccinate them, take care of them and everything. Okay. Choosing a suitable mate. So, you don't get to just go, oh, that one looks nice. You have to do the whole process, think it through. There's testing, blood testing, bloodlines, things like that. Testing the hips, the eyes. Certain requirements for certain breeds are pretty strict as to what is acceptable for you to breed, things like that. And it's all kind of that AKC-based things that we see. So, genetics. There's a lot of things that can be passed on genetically that a lot of people don't think about. Cryptorchism we talked about. Hernias, seizures is one, things like that, where you might love the heck out of your dog, but it has congenital seizures. So if you happen to breed it, then they can make more puppies with congenital seizures, and then, you know what it's like for your dog to go through seizures, and now you have all these puppies that are going to do the same thing. So knowing the goods and bads about your specific dog and the things that can come out in the breed. There are certain breeds that are most likely to get bone cancer, most likely to have problems with the urinary tract, things like that. So knowing what good and bad things can come from your breed is very important. Okay, so that brings us to the pre-breeding health check with the checking the hips, the checking the eyes, elbows. There's a whole list of things that you have to check to make sure that you're not, breeding hip dysplasia along the lines. Okay, so a little blurb about the female heat cycle. So it's a lot more complicated than a lot of people think. There's 4 stages. The first stage is when you see the swollen vulva and the bleeding. The next stage is when they're actually, they want to breed at that point. The stage after that is the body saying, okay, this is how I'm getting ready for pregnancy. If we don't happen to become pregnant, then we go into the anestrus stage. So you guys, with female dogs, they only have a heat cycle maybe once, twice a year. The time in between is what we call the anestrus. So nothing's going on in there. They're just hanging out, not doing anything. Okay. So then, mating. Typically, a lot of people do natural breeding. There are times where you can do frozen semen, chilled semen, things like that. It all depends on how you want to do the breeding process. But most people choose the natural breeding. Once you get them into the estrus portion of their heat cycle, they're willing for the breeding, and so you kind of let the male dog and the female dog figure it out on their own there. Every now and then you have to intervene. So, Once we become